Hello, I'm Dr. Kevin Caradad of the Cognitive Behavior Institute, and today I'd like to talk to you about panic disorder. Let's talk about panic attacks, since panic attacks are really, these are things that happen maybe once or twice. It's not panic disorder. What happens is when you have panic attacks and you have multiple panic attacks, and then over a month or longer, you begin to just kind of ruminate, really just think about it, or you fear having panic attacks and you begin to change behaviors. This is when it turns into panic disorder. And the following symptoms are typically symptoms that you have with panic attacks, and then when it turns into panic disorder. So tightness in the chest oftentimes is perceived, fluttering or shortness of breath, sweating, numbness and tingling, nausea, you get chills, you can shake. Oftentimes you feel like you're going out of your mind or losing control, you have a fear of dying or impending doom. So if you feel that you're having these symptoms, this is often indicative of panic attack, and then over time, or if you spend a lot of time thinking about it and changing your behaviors, it becomes panic disorder. When it comes to the treatment of panic disorder, there's basically three approaches. One is with medication, two is using technology, and three is psychotherapy. Let's talk about psychotherapy first. So with psychotherapy, what we use is cognitive behavioral therapy, and that incorporates two aspects. One is we look at your thoughts, your emotions, and your behaviors, and how they contribute to the panic attacks. So are you having a response to a particular event that's not warranted? For example, if you happen to go to a movie theater or drive, and then you get these overwhelming signs of anxiety, it's not appropriate. Unlike if a car's coming at you, it would make sense. So what we have to do is with cognitive behavioral therapy is really look at the situations. Does it make sense, the response you're having both emotionally and physiologically to that situation? And we help you recalibrate that. Second is that we teach you about those physiological symptoms that you get, those ones that we listed, like dizziness, numbness in your fingers and legs, stomach pain, those kind of things. Are those responses something to fear? Oftentimes individuals feel like that's going to lead to their death or that they're dying, going to lose control. And oftentimes that's not accurate. And so we help reshape those thoughts and your response to that and provide relief. Second is using technology. FreeSpire is a technology-based tablet that teaches you how to breathe in a different way and decreases the likelihood of you having panic attacks and panic disorder, and decreases symptoms over time. You do this treatment twice a day, 17 minutes a day at home, and here at the Cognitive Behavior Institute, we'll train you how to use that, and you can take that home with you in addition to using the CBT that we teach you here. And lastly, what we use is psychopharmacology. So the last layer of treatment is medication if deemed necessary. But there are times where medication is not needed. But that can only be determined by seeing a mental health professional who can do a full assessment on you and help discuss those different options with you. And we do that here at the Cognitive Behavior Institute. So if you have further questions or want to seek treatment for your panic disorder, please reach out to the Cognitive Behavior Institute. Our phone number is 724-609-5002, or you can reach us online, papsychotherapy.org.